Hello, for this project, I'm going to be interviewing Mr. Adamayo. Please, Mr. Adamayo, could you introduce yourself?
Hi, my name is Caesar Aramayo. I'm living currently right now in Sarasota, Florida. I'm from Lima, Peru. Currently, right now, my job occupation is I work as a licensed practical nurse in Sarasota, Florida. The hospital I work at is Sarasota Memorial Hospital, and I've been working there for about 3 years now. Um, I became a LPN, licensed practical nurse, uh, on the year of 2017. I've been working as an LPN for 4 years now, and I'm currently still working as a nurse now also.
All right, perfect. Well, I have a couple questions for you, Mr. Adamayo, regarding your job. I'm interested in pursuing this job one day in the future. So, I compose a couple questions, just five. Please just answer them to the best of your ability. So I'll start off with question number one. What are the typical day-to-day tasks that you complete in your position?
A typical day for me that I do when I first get to the hospital. Tasks that I need to complete first is, well, first before you start your job, I always get there about 30 minutes earlier than I really need to. Just so I can look up my patients. I see which patients I'm going to be being taken care of for the daytime. And then I look up information on them. Regarding information on like what I'm going to be looking up, I'm going to be looking up doctor's notes from like the ER or any type of practitioner notes that are up to date regarding the patient's care on why they're there in the hospital and what's the treatment plan for them, the plan of care. Also, things I look up are laboratory workup, blood work, showing anything such as like sodium levels, potassium levels, hemoglobin levels, which is your blood level, basically. Uh, there's a bunch of labs I look up to just see what the diagnosis of this patient is correlating with their labs. Labs will tell you a lot of like how stable the patient is and what's still needs to be taken care of on that patient. Also, things I look up with the patient is their code status. Every patient has different type of code status. Most of them are full code, which means they want full resuscitation, such as CPR. There are other patients that have DNR code status that basically means no resuscitation, and there's another type of code status, which is a modified code, which is they go in specifics on what they want to be done in case their heart stops. Other things I do when I'm looking at my patients is I want to see what if they have like any skin issues. I look into that, and then once I'm all done, prepared to get a shift report from the next nurse, from the night shift nurse. I ask any further questions that I just want to clarify on before I start my shift and start. So
Okay, Mr. Adamayo, thank you for that. Um, so could you please, I don't know what a DNR is, and Cole, could you please describe to me that real quick?
So a DNR, we use it in the healthcare field um, so that we know what's it's basically an advanced directive. When I say advanced directive, it means like, let's say if you have a heart attack, okay, you drop dead unconscious, and you don't have a pulse. Um, what what do we as medical staff need to do to help you? Okay, the first thing we need to know is what's your code status. So if a person is a DNR, do not resuscitate, that means that they don't want any CPR if their heart stops and they do not have a pulse. That means they don't want CPR. They don't want any type of medications to be pushed into them at all. And if their heart has stopped and they have no pulse whatsoever, then at that point, nothing is done for that person, for that patient, based on, documentation before, they were obviously alive before, and they had signed a paper, and that it has also been signed by the doctor previously, whoever approved of it. And it's basically an advance directive to help us, the medical staff, to know, in an emergency situation, what to do with the person who their heart has stopped and have no pulse whatsoever. So that's what a DNR is. It's a way for it helps medical staff know what type of, if the person wants resuscitation done, or if they don't want any resuscitation done in advance.
Okay, thank you, Dr. Mile. So we can go on to our second question. Um, what are some positive aspects or personal pros about your position? So, like, what's something that you enjoy about your job, or something that you view as a pro about your position?
Something I really like about my job as a LPN, as a nurse, I really like taking care of patients. In this field of nursing, you really there's many people have different reasonings on to why they go into nursing. But for me, I think it's really just taking care of people when they're at their worst. So they're not feeling well, and they have to come to the hospital. And many patients that come to the hospital, they're not feeling well. They're very sick. They're worried. They're away from their family members, away from their kids, and on top of that, they're not feeling well. There's something's going on in their body that is there, or in their body that's causing them not to feel well. So it's in nursing, we have to be there for the patients, be at their bedside, and be taking care of them. Also, the doctors, of course, are included in the plan of care of the patients, and they are the ones to do further imaging, to see what's going on, order blood work, like against imaging. We have to look at the patient as if they first come in and what they're complaining of. There are signs and symptoms. We have to investigate more into what's been happening with this person. So, which is another thing I like about, besides taking care of the patient, I like the part in nursing where you can like almost like I almost compare it to um, like in like crime scene type investigation.
So,
You
like,
have to
problem
you,
solving.
you What was that?
So, like, problem solving, and
Correct. Yeah, problem solving. So you kind of have to like look at like kind of investigate. In other words, yeah, problem solving. And if a patient comes to you or to the doctor and to the hospital, and they say they've been having abdominal pain for the past week, so you want to like kind of like start to think, okay, if it's abdominal pain, then what things could be causing the patient's abdominal pain? There's a bunch of different diseases out there that can cause abdominal pain. They could have a gallbladder that is very inflamed and it's infected. They can have also diverticulitis, which is it's a part of the intestines, mostly all the way in the lower part of the intestines, that it has like polyps. It starts creating polyps, and those polyps get infected. That can also cause abdominal pain. So there's a bunch of different things that can cause abdominal pain, but we have to listen to the patient, and kind of investigate. Okay, what have you been feeling? What's been feeling? What's been making it better? Have you taken any medications for it outside the hospital? And so once we ask all these questions, that's when the thinking starts. So like, okay, what could this possibly be? And then we go with imaging. Doctors order image like tests to look into what's going on in their abdomen, or whether it's their abdomen, brain, leg, wherever. That's where we go to. Then we do blood work too. There's certain blood work that can tell us, oh, their heart is injured, oh, their gallbladder is injured, oh, their liver's injured. So we also go with blood work too, and blood work can indicate certain things and what we need to focus more on. You know what I'm saying? There's certain blood work for every type of organ, whether it's your heart, your kidneys, your liver. So even like your brain too, or any issues with like infections going on, there are certain indicators in blood work that will let us know, us the nurses know. So that's another thing I like is problem solving, and also with taking care of the patient and knowing that there's someone there next to them that they are wanting to make sure that they are safe and they're being taken care of well, and that they're there, we're there to support the patients when they're going to their most hardest point, what I'm saying, until to the point where they get discharged and go back home. So we're always there for them, and that's the two main things: is problem solving and being able to take care of patients when they're at their worst.
Okay. Um, Given that it's a very stressful job. What are some characteristics that you would say are required for your role? Or what kind of characteristics would you expect of someone who's interested in pursuing this position?
Well, characteristics in nursing, there's a variety of characteristics a person needs in nursing, but I think mainly with nursing, I think one characteristic is being a good critical thinker. Um, with critical thinking, you got to think outside the box. Sometimes um, when you have a scenario with a patient in the hospital, there's certain things that when a patient is at their best and they're feeling well, and then out of nowhere they say, "Oh, I'm complaining of like chest pain," or they start deteriorate, they start going downwards. Their vital signs start like they crashing. The patient's starting to crash, and they're gonna get to that point where you're gonna have to start doing CPR. I think critical thinking plays a major role in there as a nurse, because you have to think outside the box to know what is causing this patient to not be feeling well out of all of a sudden. So you have to understand certain things. You have to understand vital signs. We as nurses go off of vital signs. It's like basically telling us what's your pressure, what's your heart rate, what's your temperature, what's your oxygen level. Um, all those things can tell us a lot by a person of a person. So their vital signs tell us a lot on how they're doing. So if they're, let's say, as a critical thinker like me, if a person has an oxygen level of 80% and they're complaining of shortness of breath, they're not having enough oxygen perfusion to throughout their body. Okay, so that right there tells me, okay, their oxygen level is not good, so there's something respiratory wise that could be happening. Also, another thing that could cause also your oxygen level not to be good is we think about two main things: respiratory, which is the main one, and the second one is your kidneys. So two main things is we gotta have to get, usually when a person has any type of respiratory issues, we always do order wise from the doctors, they usually do a chest x-ray to rule out any type of pulmonary embolism, which basically is a blood clot in your lungs, and that can cause shortness of breath real quick. Another thing we have to rule out is that a lot of these patients have histories of chronic diseases such as chronic kidney disease. And if their kidneys are not working well, your kidneys work they work with your lungs. So let's say we go more in the chemical part. And again, this is all critical thinking. You have to think about this stuff because these are causes on why the patient is deteriorating, why they're going downwards. So if you treat the things that is causing this patient to go downwards, then this patient is going to feel much better once you do your certain interventions. So lung wise, if the patient is not doing well with their oxygen, you always want to, if their oxygen level is low, you want to treat the oxygen. You want to put them on, usually a patient's oxygen level should be between 96% and 100. Okay. Um, if they're above 92% on oxygen, that's also okay. That's not bad. You also have to know when a patient's deteriorating, what are they there for? What's their why are they there, and what have they been diagnosed with? And also, you want to look at their past medical history. So the reason why I say past medical history because patients can have can have COPD, which is a pulmonary disease. Okay, and these patients have issues with oxygen perfusion in their lungs. It could be secondary to smoking, to secondhand smoking, to any type of for many years consuming air that's not been good for your lungs, and it's basically causes disease to your lungs at the point. You know what I'm saying? Mainly it's smokers. Some people who smoke a lot have COPD. So typically, if it's really bad COPD, their oxygen level, you don't want it to be above. You want it to usually be between 89 and 92%. They're never going to reach back to their goal of 94%, 96%, or even 100%. Because you have to think about it. You have to critical think. If patients' lungs have disease and they're damaged, in other words, that's why it's COPD. Okay, it's called congestive obstructive pulmonary disease. So their lungs are not working anymore good. Okay, they're not going to perfuse of a normal lung that's going to be between 96 and 100% with oxygen level. So we know based on what we've learned in schooling, nursing school and everything, their lungs are not going to be at the point where it should be anymore because they have a disease. It's a chronic disease. It's like saying if a person is an alcoholic has been drinking for many years and they have a history of liver cirrhosis, okay, they have a history of something. Their liver has been damaged over the past years, so their liver levels are never going to be the same as a normal person who has a normal liver. So that's when the critical thinking comes. You have to look at a person's past medical history to also try to understand certain things on why a person's cannot be feeling well. Of course, our main thing when a person doesn't feel well is to stabilize them. We want to make sure they get stabilized. When a person's not feeling well and they're deteriorating, we need to stabilize them. That's the main goal. In order to stabilize them, we have to understand the patient's past medical history with their diseases that they already have and their main diagnosis. And then we also, of course, get their vital signs, and vital signs can tell us a lot. If the patient's is not responsive, if they're not responding to us, but they still have a pulse, vital signs can tell us what they need, what they really need. Okay, it may be that their blood pressure is really low and they need IV fluids to be given to them, so we can raise their blood pressure to back to their normal. It may be that the patient's blood sugar is way too low, and that's why they're not responding to us. So what we do when their blood sugar is too low, right away, we have to give them dextrose, which is sugar. Okay, we have to give it through their IV, and once their blood level returns to a regular level for their glucose, they'll start responding back to us. So these are things you have to know off the top of your head. You have to understand, oh, if this patient's a diabetic, he has a history of diabetes, and we're giving the patient insulin, okay, and we know insulin can drop a person's blood sugar, then we need to, we have to check their blood sugar. If the blood sugar is low, that's a major sign that why the patient's not even responding. So we have to fix that. We have to fix that. And then once we do those interventions, we have to, reassess the patient and see if those interventions have stabilized the patient at this point. So I think that's a major thing is critical thinking in nursing.
Okay. All right. How, given that you work in a hospital, how does communication play a role in your position? And how do you effectively communicate with other individuals?
Communication is a big thing in nursing, especially because you work with other practitioners. So in nursing, you work with, especially in the hospital. For me, I work with doctors. I work with nurse practitioners. I work with physician assistants. And also I also work with other specialties such as physical therapists, occupational therapists, and speech therapists. And another person I work with is case managers. So communication is a big thing in nursing because you need to have good communication skills, especially because if a patient's not doing well, you need to communicate that to the doctor, and the doctor needs to know about it, so that way they can put in orders, so that way you can complete your task to help out this patient. Um, uh, with nurse practitioners and physician assistants in our unit. They work under our medical director doctor, and the medical director doctor goes with the nurse practitioner and physician assistants and sees the patients. He also reviews their orders that they put in, okay, because they're working under him basically on our unit. And another thing why communication is a big is because you need to know what you're communicating with the doctor. Certain things that if you communicate with the doctor and you already know what's going to be done based on your history of working with them already, then you should, like automatically know what needs to be done next. You know what I'm saying? So like I think with communication, you need to have really good communication skills. So that way the plan of care of the patient it goes well, and also you're able to work good with the doctors and the nurse practitioners and the physician assistants, and also with the case managers, especially too. Case managers help out with getting the patient discharged from the hospital, but their main role is to find out, does this patient need rehab? Do they need to go to a skilled nursing facility? Do they need to go to an independent living facility? Can they go home? Are they okay going home? But would they need certain things such as like rehab at home? Would they need a home care nurse at home? So those are all important things, but you need to communicate that with the case manager, and we do that a lot. Communication is a big thing also in nursing, that you need to have good communication skills. That way the patient gets what they need to get, and they are able to get the correct care that they need to get. And also another person we work with in the hospital is pharmacists, and they help out with any type of pharmacy issues that go on during the hospital and the patient's stay at the hospital, that they can verify or can look into for you if you have any type of questions. So I run into a lot of times where there's certain things that I can't, that I always have to, question it because it can possibly, have a bad effect on the patient. And so, in regarding with medications, so I'm always in communication with pharmacists just to make sure the patient gets the correct type of medications that they need, and also that certain medications are not compatible with other medications. So they need to be verified first to make sure that we can go ahead and mix two different type of medications, and that's not going to have a negative effect. There's certain times that patients that have negative effects on certain medications, and we need to know what we can give to them to stop that. We need to know what we can give the patient with certain medications that have a bad effect, and usually pharmacists are the one we communicate with that, so that we can give the correct medication to help contradict those effects. So that's another major thing. We work with pharmacists. So yeah, I mean, overall, as a nurse, I'm always in communication with every type of specialty that works in the hospital, because we are basically the advocate of the patient, so that that patient can get the best care they need.
Okay, thank you very much. So we're down to our last question. So this one I assume should be an easy one. What made you choose this role, and whom would you recommend this position to? Like I know you answered it a little bit in question number 3, where you said it's like people like what kind of characteristics people are required for this position. So like I said, it's like who would you recommend this like position to, and why'd you pick this?
Um, I would recommend this position to anybody who has interest in taking care of people. Um, Another thing I would say, who I think needs, who wants to go into nursing or interested in going nursing, um, they need to either have some type of interest in anatomy and physiology, also pharmacology too, because those are our main things you work with when you take care of a patient. So I think um, with choosing going into this career, um, I think people should look into it like shadow. There's shadowing positions you can do in nursing. There's different specialties you can go into nursing, whether it's orthopedics, cardiac, any types. So I would definitely do shadowing to look into it. But definitely, if you have you need to have a sense of passion for taking care of patients when they're at their worst. You need to have good communications with the families. That means talking to other people for the patients. So I think that's a major thing too. And also with anatomy, physiology, and pharmacology, you gotta have some type of interest in that and like it because you work with that a lot in the medical field and nursing field. So I think those are major things. A reason why I picked nursing, I've always been interested in, of course, when I was younger. Actually, when I was younger, I was afraid of taking. I was afraid of actually going to see sick people. My mom worked as a house as almost like a housekeeper in the hospital, Sarasota Memorial Hospital. And every time I went, I was scared to pass by the rooms that had actually people who were sick. Um, at the time, but then after years, and my mom, telling me, oh, these type of stories and what patients, what she sees when she passes by, I was very interested. I felt very interested to know what was happening with the person, why this happened. So I started reading books of anatomy, physiology, learning about muscles, bones, organ systems, and that caught my attention really quick. Then after a while, I started working as a nurse assistant. I got my nurse assistant license, and I help with nursing assistants usually help with bathing the patient, taking care of um, their daily life activities, brushing their teeth, helping ambulate the patient, walking the patient, um, any needs that the patient needs. As a CNA, I used to work with, I would help them out. And then after that, I just wanted to, I wanted to learn more. I've always been a type of person where I wanted to learn more, and you can get in very particular what you want to learn in nursing, and you go higher in education. So I started as a CNA, and now I'm an LPN, and I'm currently in college to get my registered nurse, and eventually I want to go ahead and get my master's in as a certified nurse anesthetist, which is basically a nurse who works in anesthesiology and can give anesthesia to patients. So in the surgical field. That's something I really that caught my attention, and that's why I pursued nursing. And now I'm an LPN, but I plan on pursuing it more while I'm in college. And so that's why I picked nursing.
Okay. Well, thank you a lot, Mr. Adamile, for your time. I think this interview went well. Thank you again for coming in.
Oh, no problem. Anytime. I'm happy to have this conversation with you, and hopefully can inspire anybody who is interested in nursing. I can show them that what is almost like to work in the nursing field as a floor nurse. And I thank you for allowing me to talk about this.
Well, thank you a lot, Mr. Adamile. I wish you the best, and I hope you take care.
All right, take care. Bye bye.
All
Thank
right,
you.
Beto.